We were discussing about nutrition and why nutrition is important in our daily life in our last lecture. Now we continue with the importance of the nutrition. Eating a nutritional diet can also help with our physical health and mental health. Eating healthy diet allows us to have more energy and become more active. Individuals who eat fruits and vegetables every single day have not shown any mental health issues. Eating a well balanced and healthy diet improve our physical health and improve our mental health. Good nutrition is linked with well-being of individual. Nutrition means getting the food and nourishment that you need for health and growth. Without nutrition, we grow weak, sick, and at the every worst can even we die. We miss developmental milestones and can't put our bodies through the daily mental and physical tasks that we need them to. We are not able to grow and may also be unable to reproduce. Nutrients are fuel. We need to enable the body to break down foods and then put this to use in the body to repair and build cells and tissues, which is basically our metabolism. The healthy human body needs different kinds of nutrients. Macronutrients are the ones we need lots of, while with micronutrients we can get by with a bit less. As you all know, our bodies need food in order to be healthy and survive. The process our body takes to metabolize causes the stress on the body. By overeating, we are creating more stress, and this could lead to a short lifespan if changes are not made. Stress can lead to the shorter lifespan of the individuals. If we feed our bodies the wrong types of food, our lifespan can hugely decline because of this. By eating diets that are rich in nutrients and contain little or no processed foods, our lives may be lengthened. The best way to get the nutrition you need is through your diet. The best way is your diet to get the accurate nutrition. The body usually processes foods better than the supplements. So this is the most effective and efficient way to get what you need. Your diet is most efficient and effective way to get the nutrition. If diet cannot do it because you cannot get the food you need or your body won't be able to tolerate it, then supplements are available too. Well, supplement your diet and nutrition needs. Always focus on the supplementation of your diet and improvement of your diet. Always pay attention to your body and your diet. Your body needs will change over time. Babies and children need different nutrients and quantities as compared with the adults. Men need different amount of nutrients as compared with the women. Women always needs different amount of nutrients as compared with men. And then pregnant or menopausal women need the different amount of the nutrients. Every body required different level of the nutrients. If you have a sensitivity of any type of food, which can also develop later in your life, your needs will change again. You may have processed foods when you were younger, but develop problems within the age. It might be possible as you grow, you have developed some sensitivity with that processed food which you used earlier, such as carbohydrates and certain type of sugars. Always pay attention to what your body needs and how you feel. If you are lacking in energy or having the trouble with your digestion, this can be an early sign that something might be out of balance. If uh, if anything seems out of balance, you should always consider your doctor about the nutritional imbalances. And most of these can be done with the simple blood test. Even if nothing feels wrong, you should still have a regular checkup with your doctor. Always keep an eye on your changing and aging body. People need to consume around 2000 calories a day. It's a rough estimation. It's not an accurate estimation. Calories requirement of the individual varies with person to person. But I am giving you an example with the calories of 2000 calories a day. People need to consume 2000 calories a day, usually across 3 to 6 meals. Eating a healthy diet means not going over that amount too often. Trying not to skip the meals because we tend to overcompensate for it later, and to get our daily caloric allowances from the right foods. Around half of what we eat should be fruit and vegetable in a wide range of colors. The broader the rainbow, the better. Then around a quarter of our intake should come from proteins such as meats, chicken, fish, legumes, dairy and nuts. And around a quarter from the carbohydrates like whole grains and starchy vegetables. We should eat very little fat or sugar that has been added to food and instead get both our fats and energy intake from sources. Healthy fats come from the proteins and things like olive oil, while healthy sugars come from the fruit and dairy. Living a longer life always is associated with the diet which contain the nutrients that are suitable for your health and contain no or little amount of the processed food may be lengthened your life. Does not provide enough nutrients or a right balance of nutrients for optimal health. This situation is known as malnutrition. Malnutrition is a condition that develops when body is deprived of vitamins, minerals and other nutrients it needs to maintain the healthy tissues and organ functions. Malnutrition occurs in people who are either undernourished or overnourished. Malnutrition is an imbalance between the nutrients your body needs to perform their functions and the nutrients it gets. It can mean undernutrition or overnutrition. You can be malnourished from an overall lack of calories. You might have a protein deficiency, vitamin deficiency, or mineral deficiency. Whatever the deficiency you have, you might also have some excess calories that your body knows what to do with. In other words, I am telling you about the malnutrition. For better understanding, I am telling you in other words, your body needs a variety of nutrients and needs of these nutrients in a certain amount to maintain its tissues and its many functions. Malnutrition happens when the nutrients don't meet these needs. You can be malnourished from an overall lack of nutrients. You may have an abundance of some specific kinds of nutrients but lack other kinds. Even the lack of a single vitamin or single mineral can have serious health outcomes for your body. On the other hand, having an excess of nutrients can also cause problems. Malnutrition means poor nutrition, which can be caused by undernutrition or overnutrition. The term is used to describe undernutrition mostly. This term is usually commonly used to describe the undernutrition. A balanced diet should provide enough nutrients such as calories, proteins, and vitamins to keep you healthy. Without this, you may not be getting all the nutrients you need, and this can lead to the malnutrition. Malnutrition can result in unplanned weight loss, a low body mass index, which is BMI, and vitamin and mineral deficiencies. These can leave you feeling tired, weak, and affect your ability to recover from an illness. Malnutrition can mean undernutrition and overnutrition. It can also mean an imbalance of macronutrients, which is the proteins, carbohydrates, and fats, or imbalance of the micronutrients, which is vitamins and minerals. First type of the malnutrition is undernutrition. Undernutrition is what people think of when they think of malnutrition. Undernutrition is a deficiency of nutrients. You may be undernourished if you don't have an adequate diet, or if your body has trouble absorbing the enough nutrients from your food. Undernutrition can cause visible wasting of fat and muscle, but it can also be invisible. You can be overweight and underweight. There are four subforms of the undernutrition, which is wasting, stunting, underweight, and deficiencies in vitamins and minerals. Undernutrition makes children in particular much more vulnerable to the diseases and death. What is wasting? Wasting is a subform of undernutrition. Low weight for height is known as wasting. Wasting is usually indicates recent and several weight loss because a person has not enough food to eat and they have an infectious disease such as diarrhea, which has caused to lose weight. A young child who is moderately or severely wasted has an increased risk of death, but treatment is possible. Waste is when the baby is with low weight for height is known as wasting. It indicates the recent weight loss and severe weight loss because person does not have enough food to eat. Another subform of undernutrition is stunting. Stunting is low height for age, is known as stunting. It is the result of chronic or recurrent undernutrition, is usually associated with poor socio-economic conditions, poor maternal health, and poor nutrition, and frequent illnesses or inappropriate infant feeding. Stunting holds the child back from reaching their physical and cognitive potential. Another subform of undernutrition is underweight. If the child is low weight for their age, are known as underweight. Children with low weight for their age are known as underweight. A child who is underweight may be stunted, may be wasted, or may be stunted and wasted both. The second form of malnutrition is overnutrition. When a person is too heavy for his or her height, abnormal or excessive fat accumulation can impair health. Body mass index, which is BMI, is an index of weight for height, which is commonly used to classify the overweight and obesity. It is defined as person's weight in kgs divided by the square of individual's height in meters, kg per meter square. In adults, overweight is defined as a BMI of 25 or more, whereas obesity is a BMI of 30 or more. Overweight and obesity result from an imbalance between the energy consumed, which is too much, and energy expended, which is too little. People are consuming foods and drinks that are more energy dense, which is high in sugars and the fats and less in the nutrient dense. And engaging in less physical activity leads to the overnutrition. Overnutrition is associated with the detrimental health effects that can be caused by the excessive consumption of the nutrients. This includes the effect of overweight and obesity, which are strongly linked with the non-communicable diseases. It also includes the toxicity that can result from the overdosing of the specific micronutrients. When your body has an excess of proteins, carbohydrates, or fats, it stores them away as fat cells in adipose tissues. But when your body runs out of the tissues for storage, the fat cells themselves have to grow. Enlarged fat cells are associated with the chronic inflammation. Fat cells has the ability to divide and enlarge. You can actually overdose on vitamins and the mineral supplements too in the overnutrition. Micronutrient overnutrition is usually uncommon and does not occur, but if you take the mega doses of the certain type of the supplements, it can have toxic effect. It's a good idea to check with your doctor if you are going to take any supplements. Always keep in mind to take supplement, always check your doctor. Malnutrition can affect anyone. Lack of knowledge of nutrition, lack of access to a variety of foods, sedentary lifestyle, and economic disadvantages all are common contributors to the malnutrition. Certain populations are more at risk of the certain types of the malnutrition. Poor and low income groups, whether in our developing countries or in the developed countries like USA, with fewer resources, poor communities have the less access to the adequate nutrition, which can cause the undernutrition. Children have greater nutritional needs than any other individual in order to grow and develop. Disadvantaged children are especially at risk of undernutrition and its consequences. Children have the greater nutritional needs which cannot be achieved. Many chronic illnesses can directly affect the appetite and individuals' caloric absorption. Some increase your caloric needs. Spending time in the hospital is also a risk factor for undernutrition. And adults growing in their ages, their nutrition can deteriorate for several reasons, including such as reduced mobility, reduced appetite, and reduced absorption of nutrient and absence of the teeth. Whatever the reason is, there are multiple reasons in the individuals advances in their ages. Their nutrition can deteriorate for different multiple reasons. In developed countries, poor communities have easier access to the fast foods, which are usually high in calories but low in nutritional values. These junk food have no nutritional values. They also provide the fat content, which have lowest satiety and satiation value. This can lead to the macronutrient overnutrition with the micronutrient undernutrition. Desk jobs, family obligations, health factors, social factors that keeps the people sitting all the time, all the day, instead of out and moving, can lead to significant weight gain. What happens to the body during the malnutrition? Macronutrient undernutrition deprive your body of energy to sustain itself. To compensate, it begins breaking down its own tissues and shutting down its function. This begins with its body fat stores and then proceeds to muscle, skins, hair, and nails. People with protein energy undernutrition are often visibly emaciated. Children may have stunted growth and development. One of the first system to begin to shut down is the immune system of person. This make undernourished individual highly prone to the illness and infection and slower to recover. Wounds take longer times to heal. Cardiac activity also slows down, leading to low heart rate, low blood pressure, and low body temperature. Individual may feel faint, weak, and apathetic about life. They may lose their appetite and parts of their digestive system. People who have macronutrient undernutrition are likely to also have micronutrient undernutrition. When overall calories are lacking, that affects the vitamin and mineral levels too. Some of the complications of the severe undernutrition conditions are marasmus and kwashiorkor, result from the particular vitamin deficiency. For example, vitamin A deficiency can cause the vision problems and vitamin D deficiency can cause the soft burns. Some people may consume a lot of calories but not enough vitamins and minerals. In these cases, the effect of malnutrition may be less obvious. People may be overweight from the macronutrient overnutrition but may have the symptoms of anemia, weaknesses, faintness, and fatigue due to the lack of the minerals or the vitamins. People shows the symptoms of metabolic syndrome such as insulin resistance and high blood pressure. Undernutrition may look like low body weight, prominent bones, and depleted fat and depleted muscles, thin arms and legs, stunted growth and intellectual development in children, weakness, faintness, and fatigue, irritability, inattention, dry, inelastic skin, rashes and lesions on the skin, brittle hair, hair loss and hair pigment loss, frequent and severe infection, low body temperature, unable to get warm, low heart rate and blood pressure. Overnutrition might look like obesity, high blood pressure, insulin resistance, and heart diseases. Undernutrition is usually caused by not eating enough nutrients. It can also be caused by certain medications and certain medical conditions that prevent your body from absorbing the nutrients. You might have trouble eating enough nutrients if you have the limited financial resources, limited access to the nutritious foods, medical conditions that make eating difficult, such as nausea or difficult swelling of the foods, medical conditions that deplete the calories, such as chronic diarrhea or cancer, and extra need for calories, such as during the pregnancy, childhood, and breastfeeding. Mental health conditions that discourage eating, such as dementia and depression. Eating disorders such as anorexia and bulimia. These are two types of the eating disorders. Malabsorption disorders such as pancreatic insufficiency and inflammatory bowel disease need to be fed intravenously for a long period. A very restricted diet or an unappealing diet chosen by someone else. Overnutrition is caused by consuming the more nutrients than you need. You might uh, do this if you have few nutritious food options, sedentary lifestyle, conditions that slow down your metabolism, such as hypothyroidism, a hormonal imbalance that interfere with your hunger and fullness signals, chronic stress, anxiety, depression, binge eating disorders, chronic overdoses of dietary supplements. These all are the causes of the malnutrition. These all these all are the causes that can create the malnutrition, either overnutrition and undernutrition. Malnutrition is unfortunately still more common in the developed countries, in situations of poverty, social isolation, and substance misuse. Most adult malnutrition is associated with the disease and may arise due to the reduced dietary intake, reduced absorption of macro and micronutrients, increased losses or altered requirements, increased energy expenditure. The single most important factor in disease related malnutrition is reduced dietary intake. This is thought to be occur due to reductions in appetite sensation as a result of changes in cytokines, glucocorticoids, insulin, and insulin like growth factors. The problem may be compounded in hospital patients by failure to provide regular nutritious meal in an environment where they are protected from routine clinical activities and where they are offered help and support with feeding when required. For the patients with intestinal failure and those undergoing abdominal surgical procedures, malabsorption is the major cause and independent risk factor for weight loss and malnutrition too. In some circumstances, such as burns, patient may have excessive or specific nutrient losses. Their nutritional requirements are usually very different from normal metabolism. It was thought for many years that increased energy expenditure was predominantly responsible for disease-related malnutrition. In many diseases state, total energy expenditure is actually less than in normal health. The basal hypermetabolism of the disease is offset by a reduction in physical activities. The exception is patients with the major trauma, head injury or burns, where energy expenditure may be high, although only for a short period of time. Malnutrition shows its consequences. Malnutrition affects the function and recovery of every organ system. Muscle function. Weight loss due to depletion of fat and muscle mass, including organ mass, is often the most obvious sign of malnutrition. Muscle function declines before changes in muscle mass occur, suggesting that altered nutrient intake has an important impact independent of the effects on muscle mass. Improvements in muscle functions with the nutrition support occur more rapidly than can be accounted for by replacement of muscle mass alone. Downregulation of energy-dependent cellular membrane pumping or reductive adaptation is one explanation for these findings. This may occur following only a short period of starvation. If dietary intake is insufficient to meet the requirements over a prolonged period of time, the body draws on functional reserves in tissues such as muscle, adipose tissues, and bone, leading to changes in the body composition. With time, there are direct consequences for tissue functions, leading to loss of functional capacity and a brittle but stable metabolic state. Rapid decompensation occurs with insults such as infection and trauma. Unbalanced or sudden excessive increase in energy intake also put the individual malnourished at risk of decompensation and refeeding syndrome. And other consequences of malnutrition is cardiorespiratory functions. Reduction in cardiac muscle mass is also recognized in malnourished individuals. Decrease in cardiac output has an impact on renal function by reducing the glomerular filtration rate. Micronutrient and electrolyte deficiencies may also affect the cardiac functions during the refeeding. Poor diaphragmatic and respiratory muscle function reduces the cuff pressure and expectoration of secretions, delaying the recovery from respiratory tract infection. Adequate nutrition is important for preserving the gastrointestinal function. Chronic malnutrition results in changes in pancreatic exocrine function. Pancreas have both endocrine function and exocrine function, and malnutrition results in changes in pancreatic exocrine function, intestinal blood flows, and intestinal permeability. The colon loses its ability to reabsorb the water and electrolytes, and secretion of ions and fluid occur in small and large intestine. This may result in diarrhea, and which might be associated with a high mortality rate in severely malnourished individuals. Immune function is also affected in the malnourished individual, increasing the risk of infection due to the impaired cell-mediated immunity and cytokine, complement and phagocyte function. Delayed wound healing is also present in malnourished patients. Physical consequences is also present in malnourished individuals. And with these physical consequences, malnutrition also result in psychosocial effect such as depression, anxiety, and self-negligence. Malnutrition in every form present significant threats to human health. Today, the world faces a double burden of malnutrition that includes both undernutrition and overnutrition, especially in low and middle income countries. In 2020, globally, 149.2 million children under the age of 5 years of age were stunted. 45.4 million children were wasted, and 38.9 million children were overweight. The number of children with stunting is decline in all regions except Africa. More than half of all children affected by wasted live in Southern Asia and Asia as a whole, is home to more than three-quarters of all children suffering from severe wasting. In terms of the targets at country level, the greatest progress is being made towards the stunting target, with nearly two-thirds of countries seeing at least some progress. About half of all countries have experienced no progress or conditions are worsening. Child malnutrition estimates for the indicators stunting, wasting, overweight, and underweight describe the magnitude and patterns of under and overnutrition. UNICEF, WHO, WB Joint Child Malnutrition estimates interagency group updates regularly the global and regional estimates in prevalence and number for each indicator. The key findings of 2021 edition includes the global and regional trends, and for the first time, country level estimates are also presented, with a summary of the enhanced methodology for driving country level model based estimates for stunting and overweight. Country progress assessment towards the 2030 target are provided, with summaries by region. In 2020, globally, 149.2 million children under the age of 5 years of age were stunted, 45.4 million wasted, and 38.9 million children were overweight. The number of children with the stunting is declining in all regions except the Africa. More than half of the children affected by the wasting. At country level, the greatest progress is being made towards the stunting target, with nearly two-thirds of countries seeing at least some progress. In Pakistan, 4 out of 10 children under the 5 years of age are stunted, while 17.7% suffer from wasting. The double burden of malnutrition is becoming increasingly apparent, with almost 1 in 3 children underweight with the ratio of 28.9%, alongside a high prevalence of overweight with the ratio of 9.5% in the same age group. The prevalence of overweight among children under 5 has almost doubled over 7 years, increasing from 5% in 2011 to 9.5% in 2018. The pattern of distribution of the malnutrition among the boys and the girls remains the same, with boys being more affected than girls by all forms of malnutrition. Children living in urban areas suffers more from undernutrition than their peers in rural areas. Overweight affects the children equally, irrespective of the locality, whether they are the residents of rural area and natives of urban areas. Stunting is a major problem in Pakistan, with 12 million children with low height for age, to ensure that this form of malnutrition does not continue to compromise the human capital required to sustain the socio-economic development of Pakistan. Stunting reduction is a top national priority. The national average 40.2% masks provisional disparities. The prevalence of stunting varies from 32.6% to 48.3%. The prevalence of stunting among the young children in Sindh, Balochistan, KPK and Gilgit-Baltistan is higher than the national average. And the wasting since from 19 to 97, the prevalence of low weight for height among young children is on the rise from 8.6% in 1997 to 15.1% in 2011 and 17.7% in 2018. Despite improvements in other socio-economic indicators, acute malnutrition remains in a state of nutrition emergency. This is the highest rate of wasting in Pakistan's history. The prevalence of underweight among children under the 5 years of age is high in all regions, from 19.2% to 41.3% in Sindh. The prevalence of underweight is below 20%. The study estimated the proportion of overweight children under 5 to be 9.5%, twice the target set by the World Health Assembly. Prevalence is highest in KPK, which is 18.7%, and in Balochistan, the percentage is 16.7, this rate is lowest in Sindh, which is 5.2%. And the prevalence of overweight among the young children exceeds 10% in KP, Balochistan, and Azad Jammu and Kashmir and Gilgit-Baltistan. This figure depicts the prevalence of malnutrition by locality, either urban or rural. In urban areas, the stunted children were 34.8% and wasted children were 16.2% and underweight children were 24% and overweight children were 9.6%. But in rural areas, stunted children are 43.2%, which is higher than that of the urban areas, and wasted children in the rural areas were 18.6% and underweight children were 31.6% and in the rural areas overweight children were 9.4%. In the rural areas, the prevalence of malnutrition is higher than the urban areas. In all aspects, in stunted aspects, wasted, underweight and overweight aspects. This picture, this figure depicts the prevalence of malnutrition by gender. Blue color represents the boys and pink color represents the girl. Stunted rate in boys were 40.9% and in the girls the stunted rate were 39.4%. A small difference were present in both figures. The wasted ratio in boys were 18.4% and in girls were 17.0%. A minute difference is also observed in both ratios. and underweight ratios were 29.3% in boys and 28.4% in girls. And overweight ratio is were 9.7% in boys and 9.2% were in girls. In stunted, wasted, overweight and underweight, a minute difference is observed in both genders. This figure illustrates the prevalence of stunting by the province. You can see here the prevalence of the stunting in Sindh is 45.5%, and in KPK the prevalence of stunting is 40.0%, and in GB the ratio is 46.6%, and in Balochistan the ratio is 46.6%, and in Punjab you can observe here the ratio is 36.4%. The largest ratio of these stunting is in Sindh and KPNMD. This picture shows the prevalence of wasting by the province. Maroon color represents the critical wasting and red color represents the seriousness of the wasting, and medium and yellow color represents the medium wasting. And in Sindh you can observe here the ratio of the wasting is 23.3%, and in Balochistan the ratio is 18.9%, and in Punjab the ratio is 15.3%, and in GB the ratio is 9.4%, and in KPK the ratio is 15.0%. The highest ratio of the wasting is present in the Sindh. This picture shows the prevalence of underweight by the province. In Balochistan, the rate of underweight is 31.0%, and in Sindh, the ratio is 41.3%. And in Gilgit-Baltistan the ratio is 21.3%, and in Punjab the ratio is 23.5%. The highest ratio was observed in Sindh, which is 41.3%. Now this last figure illustrates the prevalence of overweight by region. In Sindh, the ratio of overweight is 5.2%, and in Balochistan the ratio is 16.7%, and in Punjab the ratio is 9.9%, and in Gilgit-Baltistan the ratio is 12.2%, and in KP the ratio is 12.9%. Malnutrition is a very critical situation. Is now it's a global problem in both the developed world and in the developing world. Poverty and lack of understanding of the nutrition are the leading causes of the malnutrition. We can help control the disease of malnutrition with better worldwide education and support for the disadvantaged, including the access to clean water, nutritious food, and medicine. Children and elders who may not be able to advocate for themselves are especially at risk and may need closer attention paid to their diet and health conditions. The best way to prevent the malnutrition is to eat a well balanced diet with a variety of nutritious whole food in it. If you have enough of all the nutrients your body needs, You will be less likely to overeat, trying to satisfy those needs. Some micronutrient deficiencies are common even with a fairly standard diet.